All right, class, today we're going to cover the airway section of your skills manual. Go ahead and open up to the table of contents if you have your skill sheet. If not, that's fine. I'll put it right here on the table here so you guys can see it. Switch over to the view. When you look down at the table of contents, you'll see airway adjuncts, bag valve mask, non-rebreather, nasal cannula, airway suctioning. All of that is going to be included in your airway skill station that you're going to test for. So when I remove this, you have the progressive administration and patient ventilation testing sheet. We're going to do it in a progressive manner. So first thing you have is your mannequin, NPA, OPA. So you got your mannequin right here, NPA, OPA, bag valve mask, face mask. You got your O2 tank, you got your regulator. I got my PPEs, goggles, and suctioning device. All of this will be needed for your skills exam. When you open up the O2 tank right here, you'll see you have the nasal cannula, some tubing, and the non-rebreather mask. So keep that in mind when you're testing. It'll be included in the O2 tank. You'll see right here, we just went over gloves, eye protection, mannequin, NPA, OPA, water-soluble lubrication, nasal cannula, non-rebreather mask, bag valve mask, the suctioning device, and O2 tank and regulator. You have your standard scoring right here. You have 0, 1, and 2. You are going to be given a scenario. So the first thing I want to do is, of course, BSI PPE Pen Man. I'm going to don on my personal protective equipment, which is going to be my gloves and my goggles. All right, so let's take a look at the skill sheet again. We're going to do a progressive airway, like I said. The first part here, of course, self-explanatory. I'm not going to explain it, candidate, date, start time, etc. And all of your equipment that's going to be required. It's going to be provided to you at the test station. Scoring is standard, and then it's going to be a scenario-based skills exam. If you're called to a scene of a 65-year-old male sitting on the bed complaining of slight difficulty breathing. So progressive airway, right? Progressive airway. We don't go 0 to 100 right away. So if they're just having slight difficulty breathing, what are you going to do? Of course, assess the patient and start them on a nasal cannula. Start them on a nasal cannula. We're going to start off, I'm going to switch views right here. Inspect the O2 tank. I'm going to take the O2 tank out, make sure it's intact. There's no damaged parts to it. It's actually O2. It's painted green. Take a look at the valve. Make sure it's okay. I'm going to open the valve, lefty-loosey, righty-tighty. Let the air come out. Close it again. That's going to expel any debris that's caught inside it. Put this back in so it doesn't roll away. You never want to leave your O2 tank standing, by the way, because it may fall. The regulator may break off, and it's going to be a projectile. Next, inspect your regulator. Make sure it's at 0. Regulator needle's good. And there's a gasket inside here. Make sure you look at the gasket. Make sure the gasket inside it. And then I'm going to place this regulator onto the O2 device. Like so. Tighten it. We're good to go. Once I get that on there, I want to turn on the regulator. Go all the way to the left. Once you meet resistance, I'm going to go quarter turn back to relieve that pressure on the gasket. You don't want to leave pressure on the gasket. Take a look at the dial. 2000 is full. Then you're going to turn the dial, turn it on, expel any dust out of that valve, place it back to 0. We're going to start with nasal cannula because this guy is having difficulty breathing. Place the tubing onto the tank. Turn it to 2 liters. It's 2 to 6 liters. Make sure the flap is towards the bottom. Go around the ear. These mannequins sometimes can be difficult because they have like no ear, but there you go. Place it snug but not too tight so they don't get too uncomfortable there. Now the patient should be getting oxygen. Take a look at this skill sheet right here. When you flip over to the O2 portion of it, there it is. All right. Oxygen delivery systems. Devices, nasal cannula, 1 to 6%. of oxygen delivered, 24 to 44. You will need to know that for the exam. Non-rebreather mask, 10 to 15 liters, 70 to 90% oxygen delivery. And bag valve mask with reservoir, 15 to 25 liters per minute, 100% oxygen delivery. So you'll need to know all these numbers going forward. All right, so now let's take a look at the skill sheet again. The patient now has increased work of breathing. So if the patient has increased work of breathing, progressive airway, what are we going to do? We're going to place the patient on a non-rebreather mask. So first thing I want to do is prepare the non-rebreather mask. The patient now has increased work of breathing. Student should now place the patient on a non-rebreather mask. So now what we're going to do is prepare the non-rebreather mask. Go ahead and grab your non-rebreather mask. Make sure the O2 tube is attached to it. I'm going to take the nasal cannula off of the patient. Turn the valve back to 0. Unhook the nasal cannula. Set it aside. Hook up the O2 tubing from the non-rebreather mask. Set it to 10 to 15 liters. Pre-fill the reservoir. Then attach the non-rebreather mask to the patient. So I'm going to go ahead and do that. Go ahead and take a look at that. Okay. You could also cinch the mask a little bit for a snug fit. There's usually a metal band right here that you can also cinch right there. And when we go back to the skill sheet, once again, make sure you know that non-rebreather mask, 10 to 15 liters, 70 to 90% oxygen delivery. All right, so now the patient has entered respiratory failure and has become unconscious with respiratory rate of 6 per minute. So the first thing I want to do is place an OPA. All right, I'm going to grab my OPA kit, open it up. There's all kinds of different sizes. Corner of the mouth to the tip of the earlobe is how you're going to measure it. First thing I want to do is a head tilt chin lift, palm on the forehead, fingers under the chin, and do a head tilt chin lift to open up the airway. And go ahead and measure corner of the mouth to the tip of the earlobe, the J turn right here, the tip towards the top, and then as I'm pushing downward, I'm going to do a 180-degree turn. Let's go back to the skill sheet. Now that I've done that, the student should now, patient has regained a gag reflex and has vomited. Oh no, now we're going to have to suction. The student should now remove the OPA and suction the patient and insert an NPA and continue to ventilate using a bag mask device. All right, so let's go back here. I'm going to go ahead and remove the OPA device. You can turn the patient over to let any secretions out. And now we're going to prepare the suctioning device. You have your mechanical suction device. You have your yonkers right here. Make sure it's working. Good to go. The tubing gets attached to the patient portion of it. And then on the yonkers hole right here, when you cover up that hole, it's going to suction it. When you let it go, it's not going to suction because air is going to get sucked in through that hole right there. Okay, so that's how you control it. You go ahead and turn on the suction device. Place this patient back. Grab my suctioning. You just want to go inside. You never want to go past where you can't see the tip. Okay, so again, tip of the earlobe to the corner of the mouth is typically where you want to go. That's how far you want to go. Insert it into the airway. I can still see the tip. Go ahead and suction in a circular motion on the way out, no more than 10 seconds. So you see that suctioning out. When I let go, it's going to reduce the suctioning and then suction on the way out. Okay, so I'm going to do a circular motion all the way. All right, turn off the suctioning device there. All right, now I'm going to grab my NPA. I'm going to measure it from the tip of the nose to the tip of the earlobe. Tip of the nose to the tip of the earlobe. Okay, the tip of the nose to the tip of the earlobe. So I'm going to get my spray lubricant here to make it a little bit easier. The bezel, or bevel I should say, towards the septum. And I'm going to insert it with a twisting motion all the way down into the patient's nostrils. Now I'm going to prepare the bag mask device. The bag mask device may come collapsed. You have to expand it. Make sure the tubing is back here. This is for the capnography. This is for the O2 back here. Attach the bag mask to the O2. I'm going to set it at 25 liters per minute to get maximum airflow. Attach the face mask. And then since this is going to be rescue breathing, go ahead and do a head tilt chin lift. I'm going to give one breath every 6 seconds. 4, 5, 6. 1, 2, 3, 4, 5, 6. Okay, and that is your progressive airway management skill station there.